In this video, I'm going to give examples of symptoms of PCOS and simple lifestyle solutions to reverse symptoms and reclaim health. Insulin resistance is at the root cause of PCOS, and it is 100% reversible with lifestyle. PCOS is a syndrome that begins with symptoms. When your diet lacks nutrients, your body tells you with symptoms. We want to get good at looking at symptoms with curiosity instead of fear, because your body is never against you and symptoms are information. PCOS is second to birth control in the number one hormonal imbalance that women face. Whether you are trying to get pregnant or trying to reverse symptoms, balancing hormones is a big topic right now and is very important for female reproductive health. We're going to talk about the 6 symptoms of PCOS and, more importantly, 3 simple solutions for reversing symptoms and reclaiming health. Sometimes the symptoms are there before you can actually see cysts on the ovaries in an MRI, so it's important to test hormones for a better picture of what's going on in the body. The first symptom is chronic fatigue. This is the most common symptom I come across as a coach. It can be on a spectrum of just feeling blah all the way to severe depression and anxiety. I see this a lot with women who are just coming off birth control, have just given birth, or are under a lot of psychological stress. In any scenario, it deserves care and attention. Number 2 is hair growth. Hair growth related to high testosterone and imbalanced hormones in women will present itself on the face, the nipples, the chest, and other areas. Number 3 is irregular or painful periods. Premenstrual syndrome, or PMS, is a symptom of imbalanced hormones and is not normal, but it is common. This is one of the first signs of insulin resistance and PCOS in women. Number 4 is increased abdominal fat. The body stores fat in the abdomen as a response to insulin resistance. This can be frustrating for women, especially because we start to feel like we can't eat what everybody else eats, and in most cases what everyone else is eating is not ideal for them either. If you are insulin resistant, you will need to be more careful with carbohydrates, and especially as women age, we need to pay closer attention to fiber and protein intake and avoiding refined carbohydrates to control abdominal fat. Number 5 is acne. If you have had acne on and off for your entire life, odds are your hormones need balancing. Usually cystic acne is stress-induced and is made worse by a diet high in sugar and refined carbohydrates. Acne on other parts of your body like your chest, back, and arms is also a sign of hormonal imbalance. Number 6 is autoimmune symptoms like joint pain and swelling. When your immune system starts attacking the soft tissue of the body, it can lead to arthritis, fibromyalgia, Ehlers-Danlos syndrome, and even type 1 diabetes. I had personal experience with this when I was 23, which I think is partly why I confuse so many doctors, because it isn't common to see a 23-year-old with severe joint pain. I want to share a story of how I fixed my symptoms with lifestyle interventions, because it was actually a super gradual process and it didn't happen all at once. When I was 23, I was hospitalized for severe joint pain and swelling in my legs. I had the majority of the symptoms I described, and that experience made me realize I need to start taking care of myself, and so I spent hours a day researching. The first thing I did was start supplementing, then I gradually changed my diet, and I started really intentionally managing my stress, and I haven't experienced symptoms in a few years. I needed to hit rock bottom to realize that I was not doing a good job at taking care of myself. Changing lifestyle instead of treating PCOS with medication means you need to change your behavior. Behavior change takes longer and feels harder, but will lead to a high quality life. I could talk about this model alone for hours, but just understand that most people cycle through contemplation, preparation, and action when it comes to changing habits, which is why it never becomes permanent. In order to create lasting habits, you need to do a behavior for longer than 6 months, and that takes discipline and consistency. So my goal is to make diet and exercise and stress management simple so that you can drown out the noise and just do it. The perfect diet for reversing insulin resistance is a little bit different for everyone, but there is one thing that is a good rule of thumb for everyone. Limit sugar and refined carbohydrates and eat a lot of protein. To reverse PCOS, usually it means you need to simplify your diet. The best way to think about it is you need to feed your gut with fiber and protect your liver with high quality protein. I talk about this in pretty much all my videos, but I'll throw my list of foods on the screen here for good ones to start with if you need guidance. I do have a video about how to track calories and macros, which I will link below. You can do a balanced approach at first if your diet is currently very high in carbs to help ease you into it. A balanced approach is 30% carbs, 35% protein, and 35% fat. You can screenshot this image or click the link in the description for the full video I did on tracking calories and macros. Best exercise routine for PCOS is, again, a little bit different for everyone. There is a trend right now about low cortisol workouts for women with PCOS or symptoms of PCOS, and it is true that you want to keep cortisol lower if you have chronic stress, but exercise is a tool for increasing resilience and muscle mass, and you can't really do that very well with a low workout intensity. Approach exercise with the intention of slowly increasing weights. Jumping right into a high intensity program would negatively impact cortisol and stress, but if you do it gradually and smartly, then you likely don't have anything to worry about. Building muscle mass is crucial for reversing insulin resistance. I have a full exercise library on my channel that I am keeping public. I am a big fan of primal movements, which are squat, hinge, lunge, push, and pull. This is a great place to start if you are new to resistance training. Leave a comment if I should do a video on how to do primal movements. The best way to manage stress for PCOS, psychological stress stemming from perfectionism and a need to control our external environment, is very common in women who have symptoms of PCOS. When we feel like we need to be more masculine and fake confidence we don't have, that has a huge impact on our metabolic and immune health. Managing stress is different for everyone. The tools that have worked best for myself with clients I work with are breathwork, therapy, and journaling. For breath work, set a timer on your phone for 5 to 10 minutes and breathe in for 4 seconds, hold for 7 seconds, out for 8 seconds. Therapy, to me, is a broad term for just talking to someone you trust about what you're struggling with. And journaling works really well when you have prompts. Here are some journaling prompts that you might find helpful. Without getting into it too much, it's really important to approach life with the intention of authenticity. As women, we feel like we can't be ourselves and give ourselves what we need, and we're always serving others at our own expense. Our health will inevitably take a hit with this approach to life. So managing stress should be a #1 priority, especially if you are experiencing any of the 6 symptoms mentioned. The best blood work to get if you want to measure hormone imbalance related to PCOS is cortisol, testosterone, estrogen, progesterone, insulin, and glucose. In PCOS, cortisol may be high, testosterone may be high, estrogen and progesterone may be low, and fasting insulin and glucose are commonly seen in the pre-diabetic range. Work with a medical professional to get tested and understand the results. So you should have a good idea now of what the symptoms of PCOS are and how you can reverse those symptoms with lifestyle. If you found this video helpful, give it a thumbs up and leave a comment. Also subscribe to my channel for more health and fitness educational content. And see you next time.